Good afternoon. We'd like to welcome you to this Plymouth COVID-19 update number 11. This is coming to you live from PACTV studios in Plymouth. It is March 28th, 2020, and we're starting at 12 noon. This forum is being brought to you live on Comcast channels 13 and 15, Verizon channels 43 and 47. You can also watch this on PACTV's streaming channel by going to pactv.org/live. Now today, for questions during today's update, you can mail PlymouthInfo@pactv.org. And once again, these forums are replayed at pactv.org/Plymouth. We have another great lineup today. As always, we're joined by Ken Tavares, who is chair of the Plymouth Board of Selectmen, and Matt Muratore, our Plymouth State Representative. Today, once again, we have Amy Naples, the Executive Director from the Plymouth Area Chamber of Commerce. And in response to a question we had yesterday, we've now been joined by Russell Shirley. He is a member of the Plymouth Housing Authority. We have Dr. Barry Potvin, who is a member of the Plymouth Board of Health. Michelle Bratti joins us once again. She's the Director of Elder Services, and Father John Cullity from St. Mary's Church here in Plymouth. And we're going to begin by going right to Ken Tavares, Chair of the Board of Selectmen. Welcome, Ken.
Thank you, Steve. Good afternoon, everyone. Today we need to have a very serious talk. Yesterday we failed miserably to keep our distance from one another in many of our public spaces. We are not protecting our community with this conduct. We become the problem. This isn't an extended vacation nor a waterfront festival. Take this virus seriously. We must change our behavior. This virus does not discriminate. Young and old are being infected and at serious risk. We can and must do better. Do not put our front lines at risk. Protect them as well as your family, your friends, your neighbors, and those that you haven't even met yet. We gain on this crisis by keeping our distance from one another and meticulously following all the guidelines so well laid out by our health authorities. Our job, and especially today and being such a beautiful day, as citizens, is to flatten the curve. Again, please pay attention to the distancing and do what is necessary to keep this community safe. You are part of the front line now. Thank you.
Thank you. That's Kenneth Tavares, Chair of the Board of Selectmen. He's leading by example. He's zooming in to this update, as are all of our participants. I'm here alone in the studio. We're next going to be joined by Russell Shirley. Russell is a member of the Plymouth Housing Authority, an elected member, and yesterday we received a question about residents at our Plymouth Housing Authority residences, and the question was, can family come and have contact with the residents to bring food and medication? So welcome, Russ. What do you have to tell us?
Well, we have posted signs on all our properties directing limited access to the sites. We're trying to keep as much activity within the building is down as much as possible. In order to protect their vulnerable residents from COVID-19, we've asked them not to enter the building unless they're required to do so by resident necessity. So if a family member if there's a resident necessity, medication, food is required to get to a tenant, somebody can go in and make that delivery. But we've also worked to make sure that we've got in place alternate methods for getting, with protected people getting into the buildings to make these deliveries as well. I guess our suggestion is there's a lot of our units that are on the ground floor with alternate entries. And rather than going through the main entry and going through the common areas, make the phone call ahead, get the person to the ground floor door and make the delivery through the alternate entry method. But as I said, there's a lot going on in the Housing Authority, and wish the best of the community, and we just want good and healthy contact that is made. Most of the people that are going into these units are healthcare professionals. They know what protections to take. They've got the masks, they've got the gloves. They take the appropriate sanitation when they go in to visit our residents. And we want to make sure that if family members go in, it's not a social call. It may be a call checking on well-being, making a prescription delivery, making a food delivery, but keep it as limited as you possibly can.
Thank you. That's Russell Shirley. He's a member of the Plymouth Housing Authority. He and all of the other participants will be joining us once again as we have a question and answer session, as well as their closing thoughts. We're doing this because we want to provide verified information to the Plymouth community from trusted sources, from town officials, from regional and state officials, as well as from experts in particular areas that are affecting us as a result of the coronavirus. And at this time, we're going to go to one of our Board of Health members. We're trying to introduce you to every member on the Board of Health. And you heard earlier that Ken Tavares was talking about the need for social distancing, physical distancing. And we welcome Dr. Barry Potvin, who is a member. Welcome, Barry.
Yes, thank you, Steve. There's a few things I'd like to touch on. Some of them are advice and suggestions. I know that a lot of people are aware of what you should be doing and what you shouldn't be doing. But please remember that anything that other people touch can harbor the viruses for at least 48 hours. That includes door handles, sink faucets, toilet handles, and things that people don't often think about that much, which would include things like ATM or credit card keypads, and especially gasoline pump handles. So when you handle those things, you should probably try to touch them indirectly with either gloves on, or certainly you could try to use some kind of disinfectant wipe or some kind of paper towel. And if you can't do that, then you certainly should, as soon as possible after handling them, try to wash your hands or use some kind of hand sanitizer. So I think that's an important thing to remember also. In terms of things that have been going on really lately involving cases, we just learned last night that Dr. Monica Burrell, who is our Massachusetts State Public Health Commissioner, came down with the symptoms. So far, she tested positive, but so far her symptoms have been relatively mild. Another thing I'd like to touch on is the new federal stimulus package legislation. And you might be aware, I assume everybody is, that you should be getting checks or direct deposits with a fairly short period of time. There may be some people, probably quite a few, who really have no immediate need for that extra cash. And so one way you could use it effectively is to simply use it to make donations. There's a lot of organizations in town that I'm aware of that could use the money. They include United Way's COVID-19 Family Support Fund. BID has a program called the Healthy Care Hearts Fund. And this one might be particularly appropriate since they really depend on funding from insurance, Medicare, and Medicaid, and they don't have many other sources of funding. There's also a Plymouth Task Force to End Homelessness, Father Bills, which you may have heard about before, the Plymouth Area Coalition for the Homeless, a group called Healthy Vibes that are providing nutritious meals to our very dedicated workforce in the healthcare facilities. There's also, I recently learned today, a new GoFundMe page set up by a family, and it's called Masks for Meds. This was done recently. They're trying to buy 50,000 masks to provide to various hospitals. Finally, in this context, I know Amy has mentioned this before, but I'd like to also suggest that you could certainly use some of the money to buy restaurant gift cards, which helps the restaurants an awful lot. Finally, I'd like to point out some things about vaccines. I've had a lot of people asking questions about that. So just some background on vaccines. On January 10th this year, the Chinese scientists published the complete genetic sequence of the COVID-19 virus. Many biotech and pharmaceutical companies then used this information to develop vaccines. The first one was made by a Cambridge company, and it's now in clinical testing, which started on March 16th. But this testing for effectiveness and safety can take approximately a year to a year and a half. So we can't really expect to see the vaccines coming any sooner than that. That's all I have right now. Thank you, Steve.
Thank you. That's Dr. Barry Potvin. He is a member of the Plymouth Board of Health. We have also been getting updates from the local hospital. You can check public alerts by going to bidplymouth.org/COVID-19 updates. We're also told from the hospital that if you're experiencing any of the following symptoms, symptoms of fever, sore throat, nasal congestion, shortness of breath, or a headache, or if you've traveled to any of the countries listed on the CDC's travel warnings, or if you've been in contact with someone who's been diagnosed with COVID-19, please contact your primary care provider prior to visiting a healthcare facility. If you're experiencing a medical emergency, call 911, but if you wish to have more information regarding COVID-19, you can go to the Department of Public Health, which is bilh.org/coronavirus, or you can call 211. And at this time, we're going to continue with today's update with Father John Cullity. He is from St. Mary's Church. Welcome, Father John.
To be with you all and to learn an awful lot about what's going on here in the town of Plymouth. Very often we talk to people. There's about four, I often say, dimensions that make us to be human beings. You know, we have our intelligence, our ability to think and reason and make choices, our emotions, our feelings. They're kind of complex at certain times, our physical health, and then our spiritual health. And I think right now we're getting so much information that is really frightening for a lot of people. And so that information is being drawn in. It sometimes makes us very fearful, very nervous, which is a very normal and human reaction to very negative news. And it affects us physically. Sometimes we get depressed and concerned about our own health. And because of the social distancing, most churches, I think all churches now have stopped having regular services. So sometimes that spiritual dimension that could give people a sense of hope is a bit lost. But I think it's always important to remember that it is our faith that often sustains us and gives us hope, even in sometimes difficult and challenging moments. Fortunately, through the advantage of technology, we've been able to, at St. Mary's and St. Joseph's in Kingston, the other parish that we service, able to bring a lot of services to people online. People go to websites, and we are recording some of our religious services so that people feel somewhat connected. We're also trying to make people aware of like a hopeful message each day that not to lose confidence and hope that God walks with us sometimes in the most difficult and dark moments of our lives. A couple of things that I think are important to remember is the fact that at St. Mary's, every Saturday afternoon, we have a program called Matthew's Table. And anybody that needs a meal can walk in off the street and be fed.
That's great.
Obviously, because we don't want people gathering together. The wonderful team that works at Matthew's Kitchen has developed a takeout process where people who need a meal can come on Saturday afternoon and receive that meal and take it with them. Also, we have food pantries, both at St. Mary's and St. Joseph's, and that food is available to people in times of need. And also, we have what is called the St. Vincent de Paul Society, which reaches out to people, again, in times of need or difficulty. Normally, St. Vincent de Paul volunteers would go to people's homes and really help them, not only to give them the food or the rent help that they might need, but also to kind of help them not to feel alone, maybe give them a program to help them manage their finances a bit better. Unfortunately, we can't do that at the present time because of the social distancing, but St. Vincent de Paul will still continue to help people who are struggling. One thing I note is that I think a lot of people, because they're stuck at home, are cleaning out their closets. We have a big St. Vincent de Paul box back at both parishes, and I noticed people stuffing a lot of clothing in there at the present time. So hopefully that will alleviate, again, some needs that people have going down the line. What is, I think, challenging for a lot of people that miss their religious services is the fact that when they gather together, they do draw support, not only spiritually, but also physically from the people that they worship with on a regular basis. And that's a great loss. I feel particularly sad for people who experiences death because we have not been able to schedule funeral services, which is really a time that people really need that spiritual uplift and the support of one another. So we just hope that through the good work of the medical authorities, that a vaccine may be approved, hopefully, as Dr. mentioned, within a hopefully short amount of time, and hopefully we can start to get things back to normal. But again, through the technology that we have, please don't feel abandoned. I think most of our religious organizations are able to respond to you by email, and please take advantage of that if you're feeling alone or feeling that you need someone to help you to work your way through this very challenging, difficult time that we all face.
Thank you. That was Father John Cullity from St. Mary's and St. Joseph's Collaborative. We really appreciate the support of our faith community during this time. And every day, as I've been participating in this, and this is our 11th update, I always receive new information that I didn't know, and I hope you are able to take this information that you're receiving today and share it with our community. The information he just provided us about Matthew's Table is a great opportunity in this community for those people that may need help with their food. Again, once again, this daily update is being brought to you live by PACTV on Comcast. You can watch on channels 13 and 15, on Verizon channels 43 and 47. You can also watch this on PACTV's streaming channel by going to pactv.org/live. And for questions for our panel today, you can email plymouthinfo@pactv.org. We've already received several questions. And finally, these forums are being replayed at pactv.org/Plymouth. And as we go to our next guest, Michelle Bratti, who is the Director of Elder Affairs. Michelle, Father John talked about people being stuck at home and people feeling alone. And we know that many of our seniors are being isolated, as Russ Shirley mentioned earlier, those who are at our public housing. What can you say today to our viewers regarding how we can help people deal with that?
Sure. Thank you so much for having me, Steve. It is a difficult time, and I think we all, to some extent, feel the same way. We are doing as much outreach as possible. To me, it's extremely important that seniors in our community hear a voice on the other end of the phone, see somebody in the form of Meals on Wheels delivery. We delivered 750 meals this week. We had a full week of Meals on Wheels, so we're really happy with that. We know that not only serves a nutritional need, we know that that serves a contact and a well-check need. It's interesting. You have to balance making people feel that they're going to be okay through this, especially, to your point, isolated seniors. We're trying to reach out and balance the how are you, but also ask them for advice. Because again, our seniors are resilient and they have been through more than we probably have, though they have. They understand things in a way that we don't, and we can learn from each other. So I think even just outreaching, even talking, calling your neighbor, calling a senior on the stoop across the way, asking how they are, but asking for tips on how they're coping. We're doing a great job with that. And I think that seniors are really happy to hear from us. I'm reaching out to, it's close to 10,000 seniors with one phone call. Technology is amazing. I do that every other night. And I just talk to them and talk about uplifting things, real things. I think also reaching out through email, we have a constant contact. We give them pertinent information, what's going on, the CDC, all of the relevant real information. but we also give them links to online streaming for concerts, online ability to talk to other people. We've put out there, we've had so many volunteers, Steve, call in and say, I want to outreach to seniors. Can I make calls? Can we talk? Yes, yes, yes. We ask seniors. I had a senior call me, Rose Lichman, I'm giving you props. And she said, you know, I think it's important that we as a community put a white light in our windows. I want to honor all of the first responders and all of the community people who are essential employees in our town who are out there doing things for us. I said, Rose, that's a great idea. She said, but also, Michelle, you know what it does? If I look out and I see my neighbor, I see a white light in the window, it just says we're all in this together. We're connected. So those are things that we're doing these days. Some are practical and some are creative, but they need to happen.
Thank you. That is Michelle Bratti, and she is the Director of Elder Affairs for the town of Plymouth. And as we go through our participants, every day we've had someone talking to us about the local economic impact. Today, once again, we're joined by Amy Naples. She is the Executive Director for the Plymouth Area Chamber of Commerce. Welcome, Amy.
Hi, Steve. Thank you. As always, good afternoon, everybody. Today, I want to do a PSA regarding the CARES Act. As most of you know, the CARES Act allocated $350 billion to help small businesses keep workers during this pandemic and economic downturn. We understand businesses are very stressed and overwhelmed and want to act quickly on the new CARES Act, but I encourage you all to do your research, seek advice from a professional, and not take advice from an unreliable source. The small business loans are complex, and experts who specialize in this are working around the clock to understand them. The implications when you don't understand these loans could be detrimental to your business. Eligible lenders have not been released by the SBA, but you can stay up to date on those lenders by visiting sba.gov. And of course, with that being said, we as a chamber are working hard to educate the business community, and we'll be offering a series of webinars this coming week. On Monday at 10 a.m., you can Zoom into a webinar facilitated by accountant Erin Andrews of Stratline. This is a great opportunity to learn more and have an opportunity to ask a question about the CARES Act. In addition, the chamber will be emailing helpful tools to understand these loans, and you can sign up on our website, PlymouthChamber.com. And as I said yesterday, each weekend, the chamber is hosting a cash mob. This is to encourage the community to support local businesses. We can do so very easily. And by doing so, you can purchase something online, purchase a gift card, schedule a future service, order takeout. All you have to do is post that on your Facebook page and tag the chamber, and we will randomly be selecting a winner, and they will receive a gift card to an amazing small business we have in town here. So there are so many ways you can support small businesses. Many businesses are certainly still open and operating through their homes. So they need our support more than ever. So I thank the community for continuing to do so.
Amy Naples is the Executive Director for the Plymouth Area Chamber of Commerce. Again, this forum is coming to you live. Comcast channels 13 and 15, Verizon channels 43 and 47. We hope that you'll email your questions to PlymouthInfo@PACTV.org. And every day we've been joined by our state representative, Matthew Muratore, who provides us with a state update. Welcome, Matt. Glad to see you again.
Good afternoon, Steve. Good afternoon. Good seeing you again. Thank you. You're doing a great job as usual. Great comments today from everyone. Really appreciate it. Let's start with, as we usually do, with the numbers as of yesterday. In the Commonwealth, 29,371 people have been tested. Of those, 3,240 total cases have been confirmed. That's 11%, with 35 deaths. And in Plymouth County, as of yesterday, there were 187 cases of confirmed cases. And in Plymouth, there are 13 as of yesterday. What I did today, in light of what Chairman Tavares was talking about with groups getting together, I broke down the numbers of the 3,240 folks who have been confirmed with the coronavirus in the Commonwealth. And it's staggering when you actually hear the age groups. I did it by age groups. Less than anybody under the age of 19, there have been only 63 cases. But it does tell you that under 19 can actually get it. Now, the rest of the groups, it's very even. It's split evenly. Between the ages of 20 and 29, there were 567 cases. Between the ages of 30 to 39, there were 581 cases. Between the ages of 40 and 49, there were 526 cases. Between the ages of 50 and 59, there were 597 cases. Between the ages of 60 and 69, there's 442 cases. And greater than 70 years old, there was 464 cases. So as you see from the numbers, this does not discriminate. It's split down the middle between males and females. So it's not discriminating against anyone. But what it is doing, as I mentioned, the 35 deaths, and what Michelle is talking about, it's affecting our elders. Of the 10 additional deaths that were reported yesterday, 2 are in their 60s, 4 are in their 80s, and 4 are in the 90s. And because you think you're young and you may get symptoms and you may get better, doesn't mean you are not affecting the elderly folks and folks with underlying conditions, because you are. So please take what the chairman said what he said, and please abide by what he's saying. Stay away from large groups. Please abide by what the governor is instructing all of us to do. We need to help and save our seniors. You are affecting them by passing it along. So please do that. Couple other things on a more of a lighter note. The tax incentives for the Commonwealth, the income tax, is now July 15th, and that will automatically be delayed. So you don't have to file taxes until then. The 14-day travel restriction, as we touched briefly on yesterday, has been put into effect. So that anyone coming in the Commonwealth, whether it's by car, by bus, by airplane, whatever, are asked to quarantine for 14 days. There is information that's being handed out at the airports, the bus terminals, at the borders, at rest areas, et cetera, to abide by those guidelines. In addition, what was announced yesterday by the governor was a toolkit. It's a resource for folks to use to check their symptoms. It's called Buoy Health. The website is Buoy, BUOY.com/mass. And you can just go online, you can check your symptoms, and then somebody can check with, somebody will contact you and talk to you about resources that are available. It's a 24/7 and it's free. In addition, the medical schools, for students who are about ready to graduate, the governor is allowing for early graduation for these students to be working with physicians at hospitals. So that is happening as we speak, to allow for more healthcare workers in the system. And as another, advanced practice nurses, registered nurses are now, there's some guidelines that are waiving them so they can actually prescribe prescriptions, not under the supervision of a physician. So what the governor's trying to do is trying to get more healthcare workers into the workplace and actually getting more help to people that are actually needing it. In addition, the Red Cross, the governor is actually, I believe, at this hour at a Red Cross site with his wife, Lauren, touring a Red Cross center to bring awareness that there is a desperate need for blood. And if you're a business out there that's listening and you have a place that you can actually open up for Red Cross, Red Cross is considered an essential business in the Commonwealth under the emergency orders by the governor. You can just call, if you can do a blood drive, call 617-699-3803, and they will come set up a Red Cross bloodmobile drive. Finally, on unemployment, there are, as we know, almost 200,000 people that filed unemployment over the last 10 days. There are so many questions that still are out there, and the Division of Unemployment has set up additional town hall style online meetings that will begin as of tomorrow at noontime. So if you go to mass.gov, Division of Unemployment, you'll see the times and how to actually get on to ask questions. And you're able to ask live questions to folks and get your answers. So that is the state update. And if I may, I'm just going to give a quick summary of the CARE Act. I know, Steve, you're working on getting a CPA on the show, hopefully by Wednesday. And as was just indicated by Amy, it's a very complicated federal program. And it is, CPAs are going through this as we speak, trying to understand it. But some of the basics of it for individuals are, there will be a $1,200 check per person, or $2,400 for a married couple. If you're making up to $150,000 as a couple, or $75,000 as an individual, and then it will go down from there. It's capped at $198,000 for a household, and whatever that math works out to, $99,000 for an individual. There's also some discussion in there about retirement plan distributions that you want to contact your financial advisor about, but you will be allowed to take up to $100,000 out of your pension, of your plans that you have, without any prepayment penalties. But there's some restrictions around that, so you want to look at that as well. And there's also some, the CARE Act has a paycheck protection for loans for payrolls. And so there's some a number of dollars being associated with this through the SBA, but the guidelines do include. I know somebody asked us earlier about nonprofits. It does include nonprofits, veterans organizations, and tribal businesses, as well as other businesses as well. So as Amy indicated, there'll be more information coming out from trusted folks, financial advisors, CPAs who are diligently working at this to actually to help companies throughout the Commonwealth and individuals as well. So we look forward to our CPA coming on later in the week.
Thank you. That is Representative Matthew Muratore, who joins us each day with a state update. We're now moving to our question and answer portion of our daily presentation. Please send us your questions to PlymouthInfo@PACTV.org. We've received several questions, and while we're now collecting them, I would tell you that if we don't have the answer, we usually get the answer before the next day's presentation. I'd like to give a preview as to people that are coming up. Representative Muratore mentioned we're going to be having a CPA on next week. Also, the executive director for the Plymouth Area Coalition for the Homeless, and also the president and CEO of the Cape Cod Canal Chamber of Commerce. But on Monday's show, Ken Tavares, Matt Muratore, Amy Naples, and I will be joined by Lee Hartman. He is the Director of Planning and Development in Plymouth. He can talk about the planning board and ongoing future planning in the town of Plymouth. Jonathan Beater is the Director of the Department of Public Works. Your questions about roads and water and sewer, please have them ready. Paul McAuliffe, he's the Director for the Division of Inspectional Services. People have questions about inspections and permitting. And we have, once again, a member of the Board of Health. We'll be introducing you to Jerry Levine on Monday. And finally, lots of questions we've been having for our state representative and our officials regarding town elections. We'll be joined by Town Clerk Larry Pizer, who'll be providing us with an update. That is Monday's lineup, and at this time, we're going to go to the question and answers. And the first question that we have is going to go back to Dr. Barry Potvin from the Plymouth Board of Health. And Barry, the question is, does the town of Plymouth have enough beds and ventilators and personal protection equipment if the number of people who test positive for COVID-19 increases and they're hospitalized? Barry.
To the best of my knowledge, the short answer is probably no. I know the governor has been trying to get more personal protective equipment and apparently has lost out on bidding for the supplies. A lot of it's going through the federal government, and then the federal government has to distribute that. Some of it has been coming to the local towns and hospitals, I believe, but probably nowhere near enough if we have a surge in patients.
Thank you. And another question now for Representative Matthew Muratore. And the question has to do with, is the state going to be taking any action for municipalities to delay the payment of the May 1 real estate taxes? Specifically, this viewer is a tenant and wanted to know whether or not some relief could be afforded to tenants who may be unable to pay rent to their landlord, and in turn give some relief to the landlord regarding real estate taxes. Representative Muratore.
Yes. First of all, Steve, before I answer that, Kevin Coughlin, the president of BID Plymouth, reached out to me during this, and the great need he has right now is PPE, the personal protection equipment. And just so everyone understands the process for hospitals to go through, they are going through the MEMA for their requests and their needs. If you're a nursing home or assisted living, you're actually going through Department of Public Health. So as Barry indicated, the governors and the command center are doing everything they can to get more equipment coming in, more protective equipment coming into these places. And right now, that's the need of the hospital. And I actually spoke to the gentleman that started the GoFundMe page that Barry mentioned about the masks. And those masks are actually coming in on Monday. So if people do go to the GoFundMe page and help pay for those, he's just looking to get the cost of those. He works for a medical company. To get back to your question, Steve, yesterday at the House late afternoon, there was a bill that would pass the House that's now moving on to the Senate that will talk about additional steps municipalities can take, and particularly with regards to real estate taxes and fees and all those services that towns provide. So we'll have more later on in the week once that finally is passed by the Senate and signed by the governor.
Thank you. That is Representative Matthew Muratore. Again, if you have questions for our panel, please email us at plymouthInfo@pactv.org. And as we do each day, our participants have had a chance now to listen to each other make their initial presentations. We're now going to go back to all of our participants. We'd like each of them to give us their thoughts and maybe a final message that they'd like to leave with all of our viewers. And we're going to begin with, again, Russell Shirley. Russ is an elected member of the Plymouth Housing Authority. Russ, welcome back.
Thank you to the rest of the participants here. I really welcome this.
And you're watching this live on PACTV.org as Russ unmutes himself. Russ, so we can hear you. And
there you go.
Thank you.
I tried to unmute once and it somehow
You're good.
back.
Go ahead.
So Steve, I'd like to thank you and the rest of the presenters today. This is very helpful and very important to get this information out factually and clearly. And when you don't know an answer, you tell people you don't know the answer, but you'll get them the answer. We don't get that from the federal government right now, but we're getting it from our local and our state governments. So I really want to commend everybody that's participating in this. I assure you that the Board of Commissioners and the Executive Director, Dee Riendo, and the staff have the citizens, our tenants' health and welfare right at the top of our concerns. There are several modifications that have been put into effect at the Housing Authority. And some of these were said by Dee the other day, but I'll just go quickly down through the list. Emergency work orders only are being addressed. Our staff really doesn't have all the PPE that require, so we're trying to get into the units only if there's an actual emergency. The office is open, but is running on a reduced staff. The rest of the people are working from home, and the required work and reporting is still happening. Public areas of all complexes are closed to tenants. All group activities have been closed. Notice was sent out last week and will be reconfirmed this week that grocery and prescription delivery services are available for our housing complex tenants. If the tenants need support to get groceries and prescriptions, call 508-746-2105 extension 200. That's the main housing authority number, extension 200. If any of the tenants that are concerned about the rent have been laid off, they should advise the office so appropriate action can be taken. And for our landlords, the choice housing rent payments will go out to landlords on regular schedule at 4/1. All annual inspections have been canceled. And the April board meeting that was supposed to be held at the Southfield complex will be done virtually. There'll be some more information coming on how that meeting will happen and what our agenda will be. And our maintenance staff will continue to disinfect all common areas, and we are arranging starting on Monday to have professional cleaners come into these areas to do further cleaning and sanitation. And again, once again, I thank everybody for their efforts. And if there's any questions, feel free to call into the office.
Thank you. That's Russell Shirley. He is an elected member of the Plymouth Housing Authority. And at this time, we're going to go back to today's Board of Health member. We welcome back again Dr. Barry Potvin. Barry, how can people contact the Board of Health, and when do you meet, and how do people participate? Barry.
Okay, well, you can contact the Board of Health via email. If you go to the Board of Health's website, you'll find that the chair, Brigida, does have an email listed. You can also contact us by going through the Department of Public Health. There are both phone numbers and email for you to contact us that way. Was the second question?
The second question was, when does the Board of Health meet?
The Board of Health generally meets on the second and fourth Wednesdays of every month. In the morning on the fourth Wednesday and in the evening on the second Wednesday. The meetings at the moment, of course, are mostly remote. There will be opportunities for people to call into the meetings, I assume. So the next one will be on as far as I know, will be on the second Wednesday of April.
And Barry, you've heard the other participants. What message would you like to leave with our viewers today?
Well, I could add something else to Matt's statement about the CARE Act.
Please do.
In terms of making donations to various worthy causes, there is apparently going to be a $300 tax deduction allowed, even if you do not itemize taxes starting in 2020 and then moving forward, as long as the donations go to a charitable or nonprofit organization. So that's one thing. I'd also like to add some of my own comments to some things that Ken Tavares has said over the last couple of meetings, and that is we really need to be really amazed by the amount of work and effort that is going into this crisis on the part of many people. Of course, those include my fellow Board of Health members and also those who work at the Plymouth Department of Public Health, Karen Keene, Margaret Coe, and Kieran and Rachel, who are new members there, the Select Board, the Town Manager, the Police and Fire Department, the ambulance EMTs, who are doing an amazing job and, of course, are putting themselves at quite a lot of risk to help us. Same thing would go for all the hospital workers, and they may have a critical need if some of their workforce starts to come down with this disease and must be quarantined. And, of course, there's also the Dirty Water Distillery that have produced some hand sanitizer and been giving it away to needy organizations. PACTV has done a wonderful job. And again, I'd like to mention that Quarantine, who are raising funds for surgical masks. I know the Plymouth Chamber of Commerce is involved in this also. And it's not only the contributions, but apparently the gentleman who actually started this has donated $20,000 of his own money, and another $25,000 has come from the foundation for whom he works. So that's all important information, I think. My last message would be really a plea to everyone out there that you really need to stay safe and you need to stay conscious of other people's safety as well. You need to stay calm, you need to stay informed, and you need to stay positive and try your best not to give in to the rampant amounts of panic and fear which are present. Just remember that we're in a lot better situation with this outbreak and this pandemic than certainly we were in the pandemic of 1918. So stay healthy, try to keep active as much as possible, and protect each other.
Thank you. That is Dr. Barry Potvin, and he's a member of the Plymouth Board of Health. And as he said, stay calm. And again, going back to Father John, we appreciate your inspirational words earlier. And what would be the message that you would like our viewers to remember today?
Well, this is very helpful to me because I didn't realize how many people are really putting their effort forward, not just here locally, but across the nation. So I think there is reason to have hope. It is hard to be patient sometimes because of the unknown. But I would say that, again, like the doctor mentioned, keep that balance in your life. Don't get overwhelmed by the news. It's important to keep abreast of it, but at the same time, too, not to be overwhelmed by it. Don't let your emotions run wild. Take care of yourself physically. And if you have spiritual resources, remember, God walks with us both in good moments and in difficult moments as we're facing right now. One thing that I try to do when we leave church on Sundays is to tell a little humorous story. Sometimes the joke goes over well. Sometimes I get a lot of thumbs down. And I don't mean to make light of the virus, but sometimes you do need a light moment. So I went to my file of best material, and I did find the story about these three mice. These three mice died and went to heaven. And after about a week or so in heaven, they bumped into God. And God said to the mice, "How are you enjoying your time here in heaven?" And the mice said, "It's wonderful, better than we could have imagined. But we're very tiny and there's so much to see. We can't get around to see all the things that are here." And so God said, "No problem," and made each one of the mice a set of roller skates. And off they rolled into the distance and had a great time for themselves. About a week later, a big old tomcat died and he went to heaven. And after about a week in heaven, God said to the cat, "What are you enjoying up here in heaven?" And the cat said, "Well, there's a lot of wonderful things to enjoy up here, but I got to tell you, one thing that's really great and I'm really enjoying are those little meals on wheels." So just keep a positive attitude. Let's hope that all joining together in a force that we can defeat this virus and hopefully turn out to be a better community, a better nation, a better world that really is helpful to those in need and also grateful for all the good things that we do enjoy. So thank you for this opportunity.
Thank you, Father John. And that's a great lead-in for our next participant, Michelle Bratti. Tell us about Meals on Wheels in Plymouth as you leave our viewers with a message.
That is a tough act to follow right there. Thank you for that. That was great. You do need some humor once in a while. It does keep the levity and keep us going. So definitely. A few things. Meals on Wheels, an essential program. Plymouth is large. We have one of the largest Meals on Wheels programs in all of southeastern Massachusetts. I think we are the largest. 750 to 1,000 meals a week. The Center for Active Living staff and the amazing volunteers in this community are making it happen. And they're doing it, and they're doing it well, and they're doing it proudly. So very happy about that. We're also working with South Shore Community Action Council. They reached out and we're creating a senior box of food, non-perishable items that will be delivered to any senior in need. You just call me, 508-830-4230, if you need or want a box or know someone, a senior that needs or wants a box of non-perishable food. We'll make sure it's delivered to you. America's Hometown Pets reached out. People love their pets. If there are seniors that need pet food, litter, they'll deliver that to you too. So also want to touch on, I think Matt touched on it, and just to reiterate, Governor Baker yesterday executing, if you are traveling into Massachusetts from somewhere else, please self-quarantine for 14 days. We're urging you to do so. Everyone on this panel has expressed a concern for elders as a high-risk group They are. Matt gave you the statistics in terms of mortality. We need to protect our elders. If you're traveling here, please self-quarantine for 14 days to help protect them. Lastly, I guess the message that I would want to give is in terms of volunteerism. Every time I've been on, I do speak about the incredible outpouring of volunteerism. I've fielded more calls from people of all ages in this town through social media. Hundreds of people have called, sent emails, contacted me on social media. Everywhere you look, you see people saying, how can I help? I'm going to tell you how you can help. I am asking every single citizen in this town to volunteer for your seniors as you've reached out. And you can do it in one way: stay home. That is volunteering. If you want to do something for the seniors in this town, I appreciate the outreach for shopping and deliveries and picking up items. Keep them coming. But you can be a volunteer in helping your elders right by sitting in your living room. Go out back, go in your backyard. Say to yourself, this is what I'm doing. Today I'm helping a senior in Plymouth by doing this. That is what I need you to do for the seniors in Plymouth. Secondly, if you do go to the grocery store, you have a neighbor who's a senior, you can either ask them if they need anything, but assume they need the same essential items that you're going to the grocery store for. If you're picking up a roll of toilet paper, grab one for your senior neighbor because they need it too. Put it on their step. They need cleaning products. They need laundry detergent. They want to stay clean. It's a simple gesture. You don't have to be in their space, but you can do that. You can help them. So pay it forward. Small things are big things. So thank you.
Thank you. And that's Michelle Bratti. She is the Director of Elder Affairs in the town of Plymouth. Amy Naples, the Executive Director of Plymouth Area Chamber of Commerce. Your final thoughts.
Thank you. Great messaging by all of the panelists, but Michelle, I'm a very proud Cal Board Advisory member, and I think that is such a great message. Stay home, people. This is impacting not yourself, but so many others. So thank you for sharing that, Michelle. For all the businesses watching today, don't forget to share your offerings and services to the Chamber's What's Happening Facebook page, as well as the Order Local Project website, which is just orderlocalproject.com. As always, if I can be of any assistance, don't hesitate to reach out. You can call the Chamber office at 508-830-1620, or certainly send me an email at amy@plymouthchamber.com. I just want to say a special thank you to all the panelists that are part of this show, that have been a part of the show. They're doing so much for the community, and we are so thankful. We are in this together, and we are certainly stronger because of that. And of course, to PACTV, Julie Thompson and Steve for providing this very informative show for our residents. So thank you. My new tagline is distance socially, support locally. Stay well.
Thank you, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. We're going back to our daily participant, Matt Muratore, Plymouth State Representative. Your final wrap-up.
Yeah, thank you, Steve. First of all, before I do the wrap-up, I just got sent to me that the president has agreed with the governor on declaring Massachusetts a disaster area. So there will be federal emergency funds that will be available. And actually, the disaster goes back to January 20th. So that's some good news for the Commonwealth and particularly the town of Plymouth. My final comments, just again, I'd like to always wrap up with some where you can go to get some information. As a reminder, you can call 211, any information about COVID-19. You can go to mass.gov/COVID-19. You can text for alerts at 888-777 and put in the message COVID-MA, COVID-MA. And again, the other one we're adding is the Bayou Health, the tool that you can use, Bayou, BUOY.com/mass. And I agree with Amy. There's been so many great comments today, and I do appreciate the humor from the Reverend as well. I may steal that and use that as well. But it's great to have so many inspirational things being talked about today from every one of you. It's so helpful for our community. And as Barry said, we need to stay calm, we need to stay informed, and most importantly, take care of yourself so you can take care of others. Thank you, Steve, and thank you to PACTV again.
Thank you, Plymouth State Representative Matthew Muratore. And that's exactly what we're all trying to do each and every day, keep you informed from trusted sources. Each day we begin with the Chair of the Board of Selectmen, and we also close with Ken Tavares, Chair of the Board of Selectmen. Ken.
Thank you, Steve. I think that today it would be very easy to sum everything up by saying ditto, ditto, ditto. I too enjoyed the joke, and coming from my pastor, go for it, Father. You did a great job. Last night, I had the opportunity to talk to each member of the Board of Selectmen, and they wanted me to extend their appreciation for what people are doing in the community. We miss you as a group. It'll be fun to get back into town hall and debate, but we know that's still a little bit down the path. We've got to go through some tougher times before we get there, but doing this together, we will get there. Michelle, the senior that suggested putting the candle in the window, great idea that all of us can participate in. Tomorrow is going to be a rainy day. Unpack the holiday closet, and I'm sure you'll find a candle somewhere. It'd be fun to see that happen in Plymouth, showing our solidarity. I know that my words were a little rougher than normal at the beginning of the program, but we are taking this so serious. This is tough love time. We've got to do some things that hurt a little bit and may inconvenience us. But in the end, we'll be back on Plymouth waterfront, and we will be celebrating. So thank you, and we'll catch up with you on Monday. Thank you.
Thanks. That was Kenneth Tavares, Chair of the Plymouth Board of Selectmen, and thanks to all of our participants, Matthew Muratore, Plymouth State Representative, Amy Naples, the Executive Director, Plymouth Area Chamber of Commerce. Joining us today, Russell Shirley, the elected member of the Plymouth Housing Authority, Dr. Barry Potvin, a member of the Plymouth Board of Health, Father John Cullity, our resident humorist from St. Mary's and St. Joseph's Collaborative, Michelle Bratti, the Director of Elder Affairs. And coming up on Monday, quickly, our lineup, Ken, Matt, Amy, and I will be joined by Lee Hartman, the Director of Planning and Development, Jonathan Beater, the Director of Department of Public Works, Paul McAuliffe, who's the Director of the Division of Inspectional Services, Terry Levine will be our Board of Health member, and Larry Pizer, Town Clerk. Thanks again for joining us. We will not be here on Sundays. We will be here Monday through Saturday. Please join us, but these forums can be replayed at pactv.org/Plymouth. Thank you for joining us today. I'm Steve Triffletti, Plymouth Town Moderator. Good day.